week education with their friends and teachers breaks my heart. If nothing changes and the same options are offered, then I ask that you should continue to allow for families who choose Acellus to still participate in school activities and sports. This is vital for kids' well-being. Thank you, Carrie Barth. And now, if we go ahead and have Mr. Peterson come forward. And as a reminder, same rules, even though I just addressed you by name, please identify yourself, share your comments, and please try to not exceed 5 minutes. So.
I'll tell you this last time. Don't hope for the time this year. Darn. I don't know how you guys feel about the handout, but I do have a handout if anybody's interested. If they're not, then maybe we can't do that now. All right. This is this is basically, and some of you guys may say this Spring Hill gaming criteria, so I was just going to talk about it briefly, but not that it's the end all. You have to have a PhD to get through it. It's kind of getting old at this point, probably, but we'll try it one more time.
Normal, not old.
No, there you go, normal. All right, you tell me when you're ready.
I'm ready.
All right, hello. As you probably know by now, my name is Franz Peterson. I want to thank you again for allowing me the opportunity to speak tonight. My wife and I have 3 children in USD 348, a 6th grader, a freshman, and a junior. This is my 3rd time speaking at a board meeting on the topic of opening up schools. As you probably already know, my opinion is that we need to allow full-time in-person learning option while still allowing a remote option for those who are not comfortable with full-time in-person school. While I've been a supporter of opening up schools from the beginning and have voiced that opinion at both the September and October board meetings, I understand there are many sides to this debate. One of the advantages of allowing more time to pass before opening up our schools is that we should now have a great deal of statistics to compare and contrast the different learning models. I am open to seeing what the numbers show. If going to school full-time and in person is markedly worse from a health standpoint, and if everyone agrees this outcome is not worth the benefits of full-time in-person school, I would support continuing the hybrid model. Additionally, if the risks to the community are such that we need to consider hybrid school for short periods of time during an outbreak, I am all for it. But let's at least look at the data and try to figure out if our strategies are making any difference at all. If the hybrid model is not producing any different results than any other districts who have opened up full-time, why would we not open up our schools? First, because I enjoy statistics, as you know, let's look at the numbers again. Here are the stats as of November 2nd, according to the CDC COVID-19 tracker. The United States has had nearly 9.2 million infections and 230,000 deaths. This is a 2.51% death rate as a factor of infected people. Although infections are increasing, the death rate continues to go down month after month. Of the 172,000 COVID-related deaths in the United States that had demographic information reported, only 70 deaths have been attributed to children ages 5 to 17. There have been 519,533 confirmed infections in children ages 5 to 17. 70 deaths out of 520,000 infections means there is a 0.013% death rate per known infected child in this age group. Again, any death is tragic, but these numbers continue to be unbelievably low. Douglas County has had 2,961 infections and 19 total deaths in all age groups combined. This is a 0.64% death rate as a factor of infected people. This is much lower than the 2.51% national average. Douglas County, and in fact all of Kansas, continues to report 0 deaths related to children younger than 18. With all of this said, my suggestion is to look at other districts in Kansas or look to other states like Texas or Florida that have opened up schools and see what the results are. I took it upon myself to call and interview 2 school districts. The first is Spring Hill School District. I talked with their district office today. Although extremely detailed, I think their plan is worth looking at. Again, I haven't vetted it, but it's worth looking at. Please check out their website and gating criteria. A couple of key points. Number one, on September 28th, their school board voted to implement a new gating criteria. This allowed their students to continue either full-time in-person learning or continue with virtual online remote learning. only 10 to 12% of their students have elected remote learning. I thought that was interesting. The remote option is being taught by their teachers, which allows them to more easily transition from in-person to remote or vice versa if needed due to quarantine or shutdown. Number two, the school district has more than 3,300 students and 550 employees. They have seen 39 student infections and 3 staff infections. They currently have one positive student who was exposed off campus, not even on the campus. In talking to them and looking at their website, it appears the overwhelming majority of quarantines are due to non-school related exposures. Number three, their COVID website is updated daily and is extremely detailed. Again, please review it if you haven't. It's a good read if nothing else. Number four, they have not restricted class size, but they have done extensive mitigation strategies similar to what we have done to lower the risk in schools. The second school district is South Lake Carroll Independent School District in South Lake, Texas. This is the #1 rated school district in the entire state of Texas. They are known nationally for not only their academics, but also their athletics and other programs. They are located in the heart of the Dallas-Fort Worth Metroplex. Here are a couple of key points. Number one, on July 29th, Carroll ISD decided to offer both in-person and remote school options. About 30% of their students elected the remote option. Their remote option is also being taught by their teachers. The school district has 8,500 students and 1,100 employees. Currently, they have two confirmed COVID staff infections and 8 student infections. They have 35 recovered staff infections and 41 recovered student infections. There is no data on where the virus was acquired. These are amazing numbers given the high prevalence of COVID in Texas and specifically Tarrant County where South Lake is located. Their COVID website is also updated daily and is extremely detailed. They have not restricted class size. And lastly, they have not restricted athletics or activities. Spectator attendance has been restricted to 50% of venue capacity. Give me 1 second. We cannot let our fears or misunderstandings of how this virus is spreading guide our decision making. As I said last time, this disease will spread, school-age children and teachers will be infected. It is simply impossible to eliminate all risk. Please look at the data and then consider what this is doing to our kids and society. If in-person school is not showing a statistically significant increase in negative outcomes, why would we not do it? Please consider opening up our schools. Thank you very much. Sorry, it's probably over on time there.
23 seconds.
Okay, getting closer. All right, thank you.
Thank you, Mr. Peterson. I'm going to switch back to electronic public comments. This one is from Travis Torres. And it says, hi all. First, I am hopeful that we can maintain the good plan that has been executed well in the first semester. Give people the freedom to choose hybrid or remote. I emphasize the word freedom. When you take away the hybrid in-person option, you are taking away people's freedom to choose. It is the equivalent to removing the remote option, which is not something that is even going to be considered tonight, is you want to give people the option to choose remote if they feel it is physically unhealthy and too risky for them to attend. Well, there are just as many people out here or more that feel it is too risky to not have our children in school due to mental health and long-term effects of social isolation for teenagers and kids. Give people the freedom to choose what is best for them. It has worked the first semester and there is no reason to change. Second, please consider adopting a weighted gating criteria. See the attached DeSoto plan for an example. And I'm sorry, I should have printed that off to give to you guys. There are actually a lot of sidebar. There are quite a few similarities. I've seen the Spring Hill one before. There's quite a few similarities between DeSoto's and this one. Just FYI, sorry about the sidebar. So let me go back. I'm going to go back with that paragraph. Second, please consider adopting a weighted gating criteria. See the attached DeSoto plan for an example. The percent positivity rate is a flawed metric that is largely dependent on how many tests are administered. It is not a good figure to use as the sole source to determine whether we allow school and activities and fans, etc. Have it be a metric along with the other items and weigh those accordingly. Add hospital capacity as a metric. This was supposed to be the biggest reason to quarantine and sacrifice our daily lives to avoid overwhelming our medical systems. The hospital capacity throughout Douglas County and the state of Kansas has been green for the duration of the coronavirus. Currently, according to KDHE website, there are 40% availability of ICU beds in the state of Kansas, 88% availability of ventilators. Only 14% of ICU beds in Kansas are currently being used by COVID-related patients. The numbers are actually even better than that in Douglas County, see below. Also, please add mental health of students as a criteria. It is too important not to have that be part of the equation. Third, do not tie school activities to school being in session. Separate the two like many districts. If school goes remote due to level orange, how is a kid and family choosing to practice and play with their team impacting anyone but themselves and their teammates that have chosen the same thing? They will not even be in school. Why do you get to choose what is best for my kid? Is this Russia? This isn't Russia. These kids have been playing indoor sports all summer and fall: volleyball, club basketball, club volleyball, club wrestling, gymnastics, etc. No issues. I will be coaching youth basketball teams this winter, and it would be ridiculous to close the school activities down while club sports are allowed to go on as usual. Shut it down if it is all shut down. Otherwise, you are not mitigating anything. You are just arbitrarily taking away freedoms. Lastly, median age of death in Kansas from coronavirus is 80. That is the median age of death. Why are we mitigating a disease that is deadly to older people with comorbidities by taking away the freedom for kids at all? If we were all in a room and brainstorming to try to solve this thing, would that even be something that was top 10 on the list of things we should do? Meanwhile, older people have the freedom to do whatever they want. They can travel, they can go to El Patron and have margaritas with massive amounts of people. They can have parties with friends, they can do whatever they want, and yet we are going to lock up our kids who aren't at serious risk to protect the rest of us? Makes no sense. Schools and school activities should only be closed if El Patron is closed. That should be the litmus test. Parentheses. I use El Patron as an example because it really is the best Mexican restaurant around, but also is packed with people every Friday and Saturday night. End parenthesis. Please, 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 we live in America, land of the free, home of the brave. Give people the freedom to choose what is best for them, as you have done up to this point. Thank you for your consideration. Is there anyone else in person that would like to make public comment? I'm sorry, do you have public comment? I'm sorry.
No, I just want to, I need to do a roll call.
Oh, okay. Chris Perry, Susan Schiffelbein, Andy Parks, Carrie Stevens, Kelly Bethel Smith, Superintendent Dorothy, Tony Brown, and Phil Harvey. You bet. Any other public comment? Okay. Now, normally we receive public comment until 7, and I don't know that we put an end date on this, so we'll continue to monitor that, I guess, as the meeting goes on, so that we're honoring that. I'll keep looking to Megan if you can help, because if someone is normally accustomed to that, we started the meeting 30 minutes early, so I don't want to cut somebody's ability off from being able to do that. So we'll keep an eye on that. Okay, at this time then, we'll go ahead and move into our agenda item, which is education planning and second semester considerations. I know we have a number of people who want to speak this evening and give some reports and updates on that. Mr. Dorothy, do you want to kind of start with, well, let's review what we did last time, and then I'll have maybe you jump in from there. So last meeting, we talked about academic trends and social emotional trends. So we've kind of covered that. Basically what we're trying to do tonight is this. We're not voting tonight, right? We are hearing recommendations. We're in a fact-finding mode. It's like, I said this to Mr. Dorothy earlier, it's like putting something underneath the microscope. We're studying the same thing, but we're switching out different lenses to look at this. We're going to be talking about special education issues. I believe Mr. Ray is coming at our next meeting, I'm hoping. So we want to try to study this from as many different perspectives, lenses as possible. This will be also an opportunity for us to ask questions that we still have, so that anything left over from tonight gives us more time before we make that vote on November 23rd. I know you guys have all gotten a lot of emails from teachers. I think Jana is here. So, yes, there she is. Jana and Mr. Dorothy cranked out an amazing survey that went out to staff and families. I do want to caution that we're not going to talk about that in terms of final results because that's still open, but we've already had a very good response rate and people really participating to that. So we have those pieces of information that are coming and will continue to come. But that's kind of the ground we've covered so far. We just want to continue to get more, and then please be writing down questions as we prepare to then have discussion. But again, we're not going to decide tonight, okay? Mr. Dorothy, do you want to kind of tell us where we're at this point?
Yeah, just what I think tonight, most certainly as Kelly has said, is tonight is not for making decisions. Tonight is to gather more information, to allow the public to make comments tonight, to share information with you, which there are a couple more speakers to come up and talk with you about some things, and then ask you what you think you might need by the 23rd in order to make a good decision about what next semester is. I understand that depending on what things happen in our county, in our community, in our schools, we may have to pivot the board and we get a massive outbreak, and most certainly we might have to pivot to something else. That also might go the other way. Vaccine comes out and there are no cases, both sides of that. So we might have to pivot from the decision the board makes on the 23rd. Here's the part that's very important about going ahead and making a decision by the 23rd if we can. If we make a change to what we're doing now, most certainly the junior high and high school have a fairly massive scheduling issue that they have to deal with before next semester would start. That also contains staffing that would go along with that, that would have to change depending on numbers. We'll have to have commitments from people about who's going to stay remote, who's going to switch back, how many students are we going to have in classrooms. So there's a lot of things to consider as far. That's why we're kind of asking for this decision that seems like it's 2 months before it would be enacted, because we really can't wait till January to make this decision. We need to have something to plan from, and parents need to plan for and make decisions about, because here's how it's going to be. All right, well then I would like my children this. And so I think we've got to give families a chance to be able to make decisions also. So that's all important. A couple things that I'd like to address, the gating criteria. Most certainly the gating criteria that came from Douglas County has been analyzed, dissected, ridiculed, whatever you want to say that it's gone through. One thing that people keep saying incorrectly is that it's totally based on percentage of positive tests. That is incorrect. It started because it was the only data we had back in August and September when we started. That was the predominant thing, were positive cases. Since that time, there are a number of different things that are involved there. Absenteeism of our staff in USD 348, absenteeism of students in USD 348, new cases in the county. And on top of that, there are a few things. One, the medical community is concerned about being overrun through LMH. How many actual in-house patients do they have, inpatients do they have that are being treated for COVID? So there are a number of different criteria that are being used to make these decisions. The other thing, most certainly a week ago, we were able to go to green for 1 week, and then it went back up. That is not all based on the positivity. That has to do with all of those things I just said. So there is more to that. The other thing that people need to understand is that those decisions are made by a group of medical professionals in this county. They don't ask superintendents our opinion. We were there to kind of work on the criteria, give our input on that criteria, but we don't get a say-so in that. I believe each week they meet on Thursday afternoons and they go through all the data and criteria that they have from our county, our schools that we have to submit every Friday. We submit our absenteeism for staff and students. Each school here in the county has to submit that on Friday afternoons. And then that goes in, and then based on the cases they have, that's how they determine whether they're going to be green, yellow, orange, or red. Luckily, we've been yellow has been the worst that we've been in. Now, as you all know, there was a week or two in there where we pushed and we weren't sure why it didn't go to orange. It didn't, but that's because there's more criteria than just that positivity rate. So I think they were looking at the total picture, which at that time, I think what saved us from going to orange was the fact that the hospitals were not being overrun at that time. So I think that's important to understand. So I just wanted to make a few comments about the gating criteria. And most certainly there's gating criteria all over the place, and we can look at that gating criteria and see what that is. But people need to understand that they're really hooked on this positivity rate. And I get why people have concerns about that, but that is not the deciding factor on whether we're in green, yellow, orange, or red. It is one factor of that. It's not the complete determining factor. Once we got rolling into school and we had absenteeism to report, actually that has become the biggest criteria now, is the absenteeism that's going on in schools and whether we have kids out for COVID, quarantining, not quarantining, and so that's important for people to know, I think. Because most certainly the Douglas County gating criteria is going to be continued to be criticized because people believe it's all about just positive tests. That's part of it, but that's not the only criteria that's involved here.
Just one point, just to clarify then. I hear what you're saying, that there's, they've got, I'm looking at the criteria right now, the current ones, but still the percent positivity tests, if that is greater than 5 but less than 10, that will by itself move us into yellow.
It could.
Right.
So I'm not saying it won't.
Yeah, so I mean, it's still a big portion.
I don't know what that crew does behind doors when they make their decision about where that goes.
I guess I don't understand what you mean.
Well, I don't know what all they're considering still when they go in there. There's this criteria, how they're weighing that out. I mean, the medical community.
Yeah, I mean, on the gating criteria, I mean, if they're doing something other than what it says, I think that's probably not appropriate, because what they've got written down is, so basically any one of the categories, present positive tests, new cases, absenteeism, and staffing, any one of those that's above the criteria, it looks like then they're going to move it to the yellow. So like we could have less than 5% stable or declining new cases, absenteeism less than 3%, and staffing being normal, but if percent positive cases are greater than 5%, then we move to yellow.
It could.
I mean, I mean, I guess I would say that I still think that the percent positive cases is still a pretty big portion of what they're basing it on. That's the exit.
It might be a musical.
So the only point I'm trying to make, Phil, and again, I don't argue with you, I get where you're going, is I want people to understand it's not just that.
Right.
It's not just that. I'm not saying they are considering it a major factor, but it's not just that as a factor that would move us into that.
Yeah, it's been the factor though that's moved us every time that we've moved, right?
I don't know that.
Yeah.
I can't speak. I'm sorry, I can't speak to that.
Yeah. I mean, to my knowledge, I think that has been the factor that's moved us. Because, you know, especially early on, before we had absenteeism, like you said, then that was the factor. And then since then,
Right. And it was to begin with, because it's about all they had.
Does anybody else have, while we're talking about gating criteria, questions that would help guide decision-making for the next time we gather? Aside from how to understand the factors. Listen, every county has come up with their way of doing it. And depending on where you go in the state, it's whatever. You know, and that's, I think, understandably been part of the frustration. Everybody is doing this a little bit differently. My issue with, well, one of several issues I have with the gating criteria is I do appreciate those districts that have included in part of their metric as some sort of fair point system in this case, and other people weight it differently, but allowing for mental health. Because here, the thing is that the pendulum can swing the other way. I would like us as a board by next week or by the next meeting, what is our district's philosophical approach? And that doesn't, I am not suggesting to throw it all out. That's not what I mean. But there have been times when the county works in our favor in terms of what color we're on, when in fact Baldwin, when you look at Baldwin's zip code, is like, oh, that's getting deep orange, right? But we're in yellow, and in fact, for 1 week, we were even in green. And if we as a board say we're going to follow the county, I will tell you, I got a couple of calls on the week that we were green. Well, we're in green, if we're following the county, why aren't we having a homecoming dance? That was literally a call I got. And, you know, depending on what your perspective is in terms of the validity of the question, it's a valid question if that's your perspective, if we as a board have said, we're going to follow the county. So we have to think about that when it comes back on the other side, and the county is doing better, but maybe in our district, we're not. And just be prepared for a consistent approach with that. So I'm not asking for an answer to that, but I do want to invite thought about that as we move forward. Anybody else have suggestions or comments, questions about gating criteria?
So as part of my job, I mean, I've got offices all over the north, well, all over the eastern half of the state. And so on a daily basis, I'm, you know, sitting down with 16, 17, 14 to 18-year-old kids. And I ask every single one of them, oh, you skipping school today? Are you in school? Are you remote? Are you hybrid? And it is an absolute dartboard approach from school district to school district to school district. And now here a semester in, I mean, I feel like there should be, to Bronze's point, there should be some kind of statistics. Somebody should be looking at this and saying, hey, look, you know, these schools that are in hybrid 3 days and 2 days a week, they're having these 0 cases. These schools that are in 5 days a week are having these huge outbreaks. I haven't seen any of that, but I feel like what we're doing is the very best that we can do with the information that we have. But I feel like at this point in time, there should be at least somebody, and I'm not volunteering, but somebody that has looked into that to say, hey, look, this is the model that is getting kids in school as much as possible with, the best outcomes, the fewest cases, all that kind of stuff, as opposed to just, I feel like what we've done is the best we can do with the information we've been given, but I don't know if it's the right thing. I don't know if it's working, we're having quarantines, but so are other schools that are doing other things. It is, are the things that was the costs that we're paying, that the costs that our kids are paying worth, the results that we're getting. And so to me, I think it's worth getting some information, finding out somewhere, somebody I'm sure is looking at that to say, look, hybrids, the 3 and 2 rotating hybrid schedule is by far the best, in which case, great, let's do that. Or they might say, look, there's no difference between the 5 days a week and the hybrid, and then we should do the 5 days a week. So I think we definitely need more information on the differences between the different models, because I know that there's a lot of different models out there. There's got to be somebody that's looking at that. So I don't know if it's, again, I'm not volunteering to study that.
Well, even within Douglas County, to your point, I want to say this in a very neutral way, but even within Douglas County, under the Douglas County gating criteria, we have schools who have chosen to do that differently. And Eudora, who I have much love for because they let us play our home football games there, so this is not a criticism, but they are a part of this Douglas County group, and they've interpreted how many days a week. And so, to your point, just having data, comparative data, what are the results, I think helps us by the time we get to the next meeting. I think that's a fair question from a data point standpoint. Does anybody else have qualifying questions about gating criteria?
I have a quick one. I'm not sure if I'm on there. I'm on, okay.
You're on.
I'm definitely on there. So Mr. Dorothy, do you know if there's any plans for Douglas County to update these criteria before we begin back in our second semester, I guess mid-January? I asked that in part because you had mentioned that they're considering hospitalization rates and capacity within that. I don't see that on this criteria here now. So I would be hopeful that they would include that statistic into the gating criteria for the county. But
I think, Chris, all I can say is the last time I met with them, which they've basically disbanded the education group now, because its purpose was to reopen schools. And then it drug on longer, but schools are reopened, other than Lawrence is not open, they're virtual school, but that's how they reopened. So they disbanded that group, so we're not meeting with them regularly. All I can tell you is the last time I met with them, they wanted to look at some different things about what was most important. I think they were worried about hospitalizations, how many people were going to end up there, because they did not want to be overrun. That was one of their biggest concerns, was that's what we should be looking at, is actually how many of these are getting to the point where they end up in the hospital and have to be inpatient because of COVID. I know that was one. I know they had a couple other things. They did come out with a, what do they call it, a report card?
The scorecard.
The scorecard. They came out with a scorecard and tried to put in that scorecard some of these newer things that they wanted to measure as far as the county and making decisions about the county with a lot of things. So anyway, that's what I can say, Chris. I don't know where that's at, or whether they were going to change the gating criteria, or how soon that was going to happen, if it happens at all. I think their thing was, it got school started. That was our job, get you open, get you started in a safe way, and then most certainly you can go from there. So That's kind of where they've put us right now. Which I understand that. The goal to start with was reopening school. That's why we spent all summer trying to figure out what's the best way to reopen. And then they carried us for a while once school started. And then it became apparent that why are we still meeting? Because we've gotten to this point and we've set this criteria, and now it's time to move on to other things, which they're worried about, not just schools, they're worried about the county in general and the overall health of the county and businesses and working with businesses so that they can stay open, that kind of thing. I did want to Phil's question about comparisons, how have we done, that kind of thing. And I think Mr. Peterson brought that up also. Lisa Patrick is here tonight, and I know Lisa's put a report together to give you about some of the things that we've faced in this district. And then she has a few opinions on that. If we could have Lisa come up now and maybe give the board that report about what she's collected for you. Maybe that gives you a little better about what we could do, you know.
Okay, yeah, I thought it might be a good idea to just touch on some of the things, maybe give everyone a little bit of food for thought and some numbers. Can you hear me okay? Okay. I don't think people have them.
We can hear, but I don't know that people online watching may be able to hear.
Okay, and I apologize for reading my public comment, but with there being numbers in it, I think I just feel a lot better if I read it to you. Okay, so far we have had 188 students and staff quarantined for 10 to 14 days. We've had 48 students and staff quarantined for shorter periods while they were suspected close contacts or were waiting on test results. Of the 188 full quarantines, 99 of those were student and staff quarantined due to being close contacts from high contact sports, which ends up being about 53%. Of those quarantined as close contacts, there were 5 that tested positive, and those are the ones that we're aware of. We've quarantined 3 classrooms at the elementary level who all became confirmed close contacts to a positive case. We also quarantined 1 class for 24 hours who were suspected close contacts to a likely case that ended up testing negative, and the class was able to return after that. These classes were all cohort groups of no more than 15 students and no more than 2 supervising adults. This is the suggested cohort group size that stays together for all activities and avoids contact outside their group in the building. Due to the interactive learning and small group learning that is necessary at those age levels, the health department suggested quarantining the cohort. And during planning this summer, we had anticipated that would be the case. The health department quarantined 4 students at the high school that were close contacts due to students being less than 6 feet apart at lunch and being without masks, of course, while eating. We've remedied that now, and we have 2 students to a table now and able to sit 6 feet apart. The health department also quarantined 4 high school students in a class of 12 because they were considered close contacts to a positive case. The class size was larger than most and didn't allow for enough social distancing between student desks. In the 7 other periods of that student's day, all of the other class sizes were between 2 and 10 students and allowed for social distancing.
I just got text messages, I can't hear you.
I did.
Yeah, you know, my mic is pretty loud.
Get serious about it. Okay, so as we look ahead to the rest of the year and next semester, of course, the colder months are coming upon us. We'll all be inside more, causing us to have more close contact and being exposed to more illnesses that occur every year when we are in closer quarters. This year, we will be adding COVID to that list of illnesses and probably seeing an increase in it during that period too. The holidays always bring travel and family gatherings that will very likely increase COVID rates and bring COVID from other sources back into the community as we return to school. So yesterday, I had emailed the staff at the health department that I've been working closely with for the last 3 months, and just wanted to give them a scenario. My scenario to them was if we were to have 22 junior high or high school students in a classroom, students would be sitting 2 to 3 feet apart and wearing masks. If a student would test positive for COVID and was sitting in the middle of the classroom, how many students would the health department likely quarantine as close contacts? So one of those staff members replied and said that would be 4 to 6 students. And then another made the comment and said, I could quote, I will just say that regardless of masks and improved ventilation, we would still request the contacts within 6 feet to be in quarantine. Because while masks and ventilation help tremendously, nothing is foolproof at this time. So we would still pursue isolation quarantine. Hopefully, with desks being spaced somewhat, that would only be a handful of people. So if classes were back to normal capacity and looking at the 8 periods at the junior high or the high school, that could be a minimum of 32 students and staff quarantining and possibly contracting COVID. And I think lunchtime is another thing that really needs to be highly considered. And honestly, when I do talk with the health department, that's one of the first things that comes up when we start talking about quarantining, basically because, you know, students are without their masks for a greater than 10-minute period. And so it's, you know, it's something that they turn to pretty quickly. So I think that's probably something we need to consider as a concern. And if we had more students in the building on a daily basis, how we would be able to manage that in the lunchroom for all 4 schools. So thank you again for all the tough decisions you made, and thanks for keeping our staff and students safe.
Does anyone have any questions for Lisa?
So I was trying to write down the numbers as you were saying, just so I don't forget them. At the high school, there was 188 quarantines, 99 because of close contact from sports. And then, but there's only a total of 5 positive cases. And that was at all at the high school level?
Yes.
Okay.
One junior high.
And,
Junior high and
okay, junior high. Okay, that's all.
So to repeat back on that too, there was 188 quarantine cases across the whole district or just at the high school?
188 for the district.
For the district, okay, okay. And how many, this might be a team effort here. How many students do we have currently in-person school? Is it like 800 or something, or 900 or something?
I'm sorry, Chris, I don't have that.
We can do the math. How many students
Yeah, I'm looking at.
and how many of what percentage are?
Based on the numbers of masks that I have separated out, there were between 700 and 800 in-person total.
Okay.
And that's A and B.
Yeah, I'm thinking of that percentage of number of our kids who are in school every day, plus or divided by the number of kids and staff who had to go into quarantine is a lot higher than that, honestly.
So in that quarantine process, you had mentioned that like in a classroom of size of 22 and somebody sitting in the middle, it's the few people that are in that close proximity. It seems like the vast majority of these are not classroom related, but more sports, because so the numbers are higher because they're not, you can't say, well, I was only close to these few people, right? So it's not the classroom where people are getting quarantined for the most part.
Right.
Okay.
Yeah, and as we go around and visit each classroom for the hours that that student was in.
Right.
Yeah, it's pretty.
You're losing 2 or 3 kids out of that classroom. Okay. Where it's harder to do for an athletic.
Chris says 80-50.
And maybe this is a HIPAA thing, maybe not, since there's not named, of those 5 positive cases, then any require medical intervention other than just staying home? Okay.
And Lisa, did any of those positive cases, were they exposed at school?
Not that we know of. Right. Nothing to really lead that to them. We had, and, about 4 weeks ago, there were only 2 cases that we just, they couldn't even figure out who their first contact was at school, but otherwise, everybody knew who their first contact was.
And what is our current protocol for the quarantining? So like, I'm playing football, somebody on the football team has it. Are we doing the full 14 days? Are we doing 10 days? Are we doing 4 days to see if there's onset of symptoms, or what are we doing?
Yeah, but we're still doing the full
14 days.
I have heard that there is talk about
Lisa,
approving less.
I really want people at home to hear this.
Okay.
Oh,
They got a top on it.
I already forgot my question, so I can't ask it again. Maybe you remember your answer.
Yeah, so basically, when we have somebody that is needing to quarantine, the health department has total input, and they require the 14 days of quarantine unless you start showing symptoms. Then once you test, then they require a 10-day quarantine from the first day of the start of your symptoms. I have heard, comments that they may be reducing that, but that has not changed yet, and the health department, would let me know when that happens. Just like they have also increased the amount of time. It was 10 consecutive minutes in a 24-hour period that you were with someone that tested positive that made you a close contact. Now it's 10 minutes anytime in that 24-hour period. Doesn't have to be consecutive.
Can you say that again? Because that was one of the questions. That was a recent CDC update. It's 10 minutes total, not so it'd be a minute here, 2 minutes there, 3 minutes there.
Correct.
It baffles my mind to think how that could possibly be. I understand going around to a classroom and saying, okay, you guys, you didn't have your mask on and it was 10 minutes. Like, I can see how you can figure that out. I'm not sure how school district personnel, even someone as highly trained as yourself as a health professional, can figure out 10 minutes over a 24-hour period because they're not here for 24 hours. So that makes my brain explode. I don't know about you.
Yeah, fortunately, we haven't come up against that yet, but yeah, it would be very difficult.
Yeah. I don't know if this would be appropriate time to ask this question about the information that we got about possible ability to test throughout the county while we still have Lisa up here. But if we could talk a little bit, I know it's still preliminary, so I want to be really clear about that. But I do think that would be nice to have that as part of the discussion as we think about, I know every I hasn't been dotted with it and every T hasn't been crossed, but would you mind speaking a little bit to what you've heard, and Mr. Dorothy, you've heard thus far about the proposed idea of testing?
Well, I think Lisa has actually been involved more than I was not able to make the second meeting on that because I was scheduled to do something else. But I think Lisa was able to make that meeting. It is something that the county is offering to school districts to do testing within the building with consent only. Nobody's going to be forced to test at all, but it would be open for staff and students who consent to it to have some testing done within the schools. Lisa, maybe you can add to that.
And I apologize, I was in on that meeting, but we also had a positive case right at that same time, so I was kind of in and out of that meeting. Dr. Eileen Wynn, maybe she would be able to answer some of the questions that I can't because she was in on that Zoom meeting with me.
And I was asking her questions earlier today too, so I don't want to put anybody on the spot, and I know that there's still things happening, but I just wanted that as part of our public discussion, just to know that there's talk about that and there's been some coalescing around the possibility that that could happen. So,
Right.
and what that would look like. So,
Yeah, and I think they're going off of percentages, in determining how many in each school would be tested. And of course, that's with parental consent, staff agreeing to do it as well. Their plan is to come in twice a month. They would have, staff from the health department that have been trained to come in and do the testing. And then the testing would be sent off to a lab. I believe it's by a grant. Is that correct, Mr. Dorothy?
Yes, I believe it's part of their
Right, and,
Sparks money, I think.
right, and of course, then that would end, that money would end at the end of the school year. And so then I think they're hoping that there would be staff in each of the buildings that could be trained while they're doing that November and December, and then the staff would take it over from there.
so one question I had is that something timeline wise that they're looking at trying to be able to provide? And obviously I think that would have to be a board. Do we accept this? Are we down for this? But, is November what they're shooting for?
Yeah, I think their goal date was November 16th.
November 16th. So, yeah, okay.
And with that, is it just like, would it be a random sampling, or is it like somebody that says, oh, I don't feel good, I want to get tested? Just
Right,
like-
it would be a random sample.
Okay, so like every third person or whatever comes through the door.
Mhm.
And that's.
Just of those that have
Consent,
signed.
yeah, consent,
Right.
consented, yeah. Right. And would the goal of that is just to be early detection, or,
I believe so, to be early detection and to catch any of those that are asymptomatic.
But that most certainly will have to come to this group to say in the end, yes, go ahead, or no, we don't want to get into that. It is not a mandate from the county. It's an offer of a service from the county. So I don't want any board members to say, well, the county's pushing this down our throats. No, that's not the purpose here. They're offering.
so on a more personal note for you, how are you, do you feel comfortable with what you're doing because I'm imagining that you're seeing some of these kids in close contact and you're not having to quarantine. So you feel comfortable with what you have as far as your protective measures?
Yes,
To not,
yeah, we do. We have all the required PPE. We've got face shields, we've got the correct mask, which is a medical grade surgical mask, gowns. Whenever we do send a student into the isolation room, say with temperature checks in the morning, then we put on, myself and the other 3 health aides put on the required PPE to go in there and basically not become a close contact if that person were to test positive.
And I'm going to be really honest. The question I asked you an email today, and it was very non-medical terms, but I straight up asked, is this a saliva? What kind of test is this? Is this a saliva test or is this the up the brain test? And that was my verbiage. And it is a saliva test. So as we think about that with that decision, I know the thought of that for little ones makes me feel differently about that. Saliva, I'm no big deal, but if it were the other test, I would have been more nervous about that. So just so that everybody has all the information on that too. Does anybody else have questions for Lisa?
so I would say that, so it sounds like from what you're saying that our mitigation procedures are working as well as you could hope to basically be able to say we've got no in-school transmission, just outside sources coming in, identification, quarantining. That what we're doing right now is preventing spread while in school, from school stuff.
Exactly.
Okay. Good.
Megan. It's you just got it.
I know that, like, if someone tests, they have to be quarantined until the result. So one of my questions had been, what type of test? And so it's the saliva. Is that one of the rapid Do they get the results right away?
That's not the saliva test, that is another antigen test. But there is an antigen test that's the rapid, takes 15 minutes. And it is a swab, but it's just a nasal swab. It doesn't, like Kelly was saying, clear up in your brain.
Because my concern would be if they were tested and then had to be quarantined until the test came back. So I was wondering if that would be a concern. Like in Franklin County, it's mandated if you're tested, you have to quarantine until you get the test back.
Right, exactly.
So I'm wondering if that would be the case for our students and staff, because that would be an issue.
I would hope not. In the surveillance thing, I wouldn't think we'd be sending anybody home unless they end up testing positive.
Yeah, and the materials you sent earlier mentioned there's a 24-hour turnaround time from when that test is conducted to getting results back. I mean, that's the plan.
Yeah, and there was no, in the meeting, there was no mention that anybody that was tested would have to quarantine until they got the results.
Yeah, I think for like a surveillance kind of testing, I think that when you're getting tested because you're symptomatic, they're saying we're going to treat you like you're positive, so quarantine unless this comes back negative, as opposed to just like as you're walking by, spit in the cup and then go to class.
Right, otherwise why would anybody consent to that?
Right.
That was a problem in Franklin because they make you do it. So our students were having that problem, and so we had to organize it so that it worked out with the quarantine and they got it back quickly. I think all my other questions were. Yeah, all my questions were answered. Okay. Thank you very much for the information. It's very helpful.
Lisa, could you share that, scan it and email it to the board members so they don't have to worry about remembering the numbers? Thank you.
Thanks, Lisa.
Kelly, at this time, I was going to give Mr. Kern an
Yes.
opportunity to
Yep.
read a statement for staff.
Yep.
I want the board to have a chance to hear. Mr. Kern, if you want to come on up.
All right, so switching out our microscope lens from a different perspective, we put from more of a strictly health perspective, and now let's hear from our teachers. And thank you, Mr. Kern, for being here tonight to do that.
Don't touch that spot.
Mr. Kern, if you'd take the microphone, you got to hold it right up there. They can't hear you at home.
I apologize for being late. I literally just walked out of the hospital from getting my IV therapy, my immunoglobulin therapy. So I've been up there for 3 hours lying on the bed getting that done. So sorry about that. I'm Mike Curran, and tonight I represent the Baldwin Education Association, BEA. I'm not here to make a recommendation on how to go back to school during second semester. I'm sure that not all the teachers agree how this should be done. And I didn't want to stand up here and represent just 70% of the teachers or 60% of the teachers. I wanted them to be able to make their own statements to you. I've asked the teachers to email you individually if they feel strongly about how to open school second semester. I know you received my opinion. I know because I sent that out to you last night, and I appreciate all the responses I got back from the board members last night. I'm just here to remind the board of a couple of things in order to make that decision. Number one, remember your goals. When we decided to start school in August, I believe the goal was to educate students to the best of our ability while keeping all students and staff as safe as possible. I think we all agree that the best way to educate students is have them in school 5 days a week. However, you decided that in order to keep everyone safe, we should offer a virtual learning program and attendance every other day at the high school and at the junior high. This allowed us to have smaller class sizes so that students can sit further apart, and this seems to have had a positive impact on the quarantine numbers. Secondly, gating criteria. You took a look at the gating criteria for the number of students in classrooms, at lunch, and in hallways. Thirdly, you took into consideration the staff. You looked at how best to protect the health and well-being of staff throughout the district, whether it be in classrooms, on buses, at lunch, or our cleaning staff. As I said in the beginning, I'm not here to make a recommendation. I only want you to compare your decision to those three criteria: your goals, your gating criteria, and the staff. No matter what you decide, I assure you that the teachers of this district will continue to offer quality opportunities for our students to get an excellent education. Thank you, and I appreciate your time.
Thanks, Mike.
Thank you, Mr. Kern, and thank you for making every effort to be here tonight. We appreciate it. I know I kind of rattled this off at the beginning, but just related to that, just want to also remind both staff and families at home that the recent survey that was sent out is still open. And though we've had a really good response already, if someone is watching and hasn't filled that out yet, please do so. That is open until the 13th almost. So that survey is open until the 13th of November. And so if you haven't done that yet, please do so and spread the word about that. We as a board have made a very committed effort to do everything we can to prioritize a high level of engagement and feedback. I think we've been very intentional about that. And the more feedback we get, the more helpful it is. Jana has already sent that to us and it updates. It updates live. So it is something that you can be keeping your eye on as that information continues to come in. We're already seeing some tendencies for now, even with a good turnout rate so far, but there still may be responses ongoing. So that's something to keep your eye on as we move towards that goal line of decision-making on the 23rd. So just wanted to bring that back up again as it relates to staff and also to families. What other questions I think we've hit the known speakers. Are we hearing from other administrators tonight?
I don't know that we are necessarily. If there was an administrator that had anything they wanted to share this evening, they can. I don't know that we specifically planned on that.
Right. You don't have to. I just want to make sure it's open, and administrators have already sent. Most of the administrators actually have already sent, what their thoughts are. But if you haven't, please do. And if you want to say anything now, I just want people to have the opportunity, even if you weren't planning on it. But I also don't want you to feel on the spot if you're not ready to do that tonight or in this forum.
I think the administrators have been working hard with their staff about trying to get to some sort of recommendations that we can provide you before the 23rd. So most certainly, we've had a lot of talks about this, talked about a lot of different ideas. We've gone back and forth. I know the high school and junior high, we were throwing out ideas today about possibilities if we considered a change of some kind. So we were talking about how that might look today. So I believe before the 23rd that the administrators, staff, myself will have some recommendations for you. Most certainly it will be your decision in the end, but we will try to have some recommendations for you based on the information that we have, what we think will work in schedules, what we think will work for families. Most certainly, Kelly mentioned the survey data. I think that's important to look at. I think right now, getting into it too much this evening would probably not be appropriate. It is showing some trends. Most certainly, when we get to the 23rd, I think we'll share that data with everyone. the public, everybody will get to see that data, because I think it's important for everybody to see that. And I do think what I like about it is, yes, I think we'll get more before the 13th, but we've gotten a really good percentage of return on it. I believe we're over 50%, and staff is higher than that. So I'd say anytime you can get that kind of return, it's great. It gives you better data that can show you that it's more, what word am I looking for? My statistics words here. Significant, the data will show you more significant information about how the general, how people feel about it, how parents are feeling about it. So I think it'll provide good data for the board and administrators as we look at it. We're already kind of looking at the trends and trying to think of how that might work. But most certainly, safety of staff, safety of students is our utmost work here in trying to make this work. I will say, and most certainly any administrator, as Mike said when he was up here, the best education model is for us to get everybody back in 5 days a week. Can we do that? I don't know yet. We've got a lot of ground to cover before we get there to keep everybody safe. So in the end, whatever recommendation, it'll be towards trying to stay safe, but get kids the best education we can in the circumstances we're living with. And most certainly, I know that's what you'll do as a board, is what you feel will work the best. A couple issues that are involved there. We are concerned about mental health of kids being secluded from school, secluded from friends. We are concerned about that and want to make sure we're addressing that. We are also concerned about the academics of kids. Anytime you make a change, a significant change in how you're delivering education, some kids will deal with that better than other kids. We fully know that. And there are some kids that have struggled in this situation because it's different for them. They're not used to doing this. So there are also students that have thrived in this and like it the way it is and have done well with it. So so I'm concerned about mental health and academics both, and how this is going to affect that. My frustration as a superintendent is I'd love to put everybody back in 5 days a week. I don't know if I can do that under the circumstances. That would be the best thing we could do, but that may not be the safest thing to do. But I think we've got some time here. We've got a couple of weeks here. On the 23rd, I at least want the board to be able to make a preliminary decision about what they want. Again, that's what we'll start planning for, what you decide on the 23rd. But I may come back to you the next month in December and say, we have to pivot again because this is going on or that is going on. We just have to, but we've known that from the very beginning of this, that there are times when we're going to have to pivot from things we're doing and not doing. Luckily, we have not had to close any of the schools completely. We've had some quarantines of classes, most certainly, but we have not had to close. That's been a good thing, because I was worried all along that we get into school for 3 weeks and then boom, we'd have to spend 2 weeks closed. That has not materialized, and that's a good thing, and it's heading in the right direction. So, but anyway, lots of discussing. So tonight, before you wrap up tonight, if you need more specific information before that next meeting, please let me know tonight so that we can start gathering that for you and get it for you.
hang up?
Well, here, they won't be able to hear you.
I'm just wondering when you said that there's some kids who are challenged by this environment and there are some kids who really thrive in this environment, would it not be a worthy endeavor to ask for their voice, especially sixth grade and beyond?
Well,
Just stand next to each other.
Actually, Jana and I discussed surveying some students, so that we can get some student input on this. Most certainly only down to a certain grade level, so that we can get good information. That we were looking at being able to survey students in order to help with that. So that's a good question.
I have one question. So I'm a list guy and I'd like to distill things down to what the kind of the core issues. So it seems to me, and I'm certainly open to discussion about it, it seems to me like we're really kind of on the 23rd going to be kind of, there's two major decisions that we need to make or that we need to come to an agreement on. One is the gating criteria that we're going to use. Whether we continue with Douglas County, whether we do some modification of somebody else's or come up with our own. So the gating criteria, and then what we're going to do 5 days versus the hybrid for the second semester. Those are kind of the two core issues that we're going to start coming ahead on the 23rd. Right?
That's how I would see it, Phil. Those are the two biggest questions that you guys will, is whether we do the 5 days a week,
Right.
For 7 through 12, or and then also considering, is the gating criteria doing what we want it to do? Do we want to adjust that? Right. And so on. So that would be the two biggest things. Yeah. There is another question that I don't think is really a question, but maybe the board feels it's a question, is the remote learning. Mm-hmm. Will we continue remote learning option in the second semester? My recommendation is we should continue a remote learning option for students second semester. And I know we asked in the survey, but I don't think that was just to get an idea and give people an opportunity to answer that way. But I don't think we really considered that we wouldn't allow remote learning choice by parents for a second semester.
I have a few questions. Some of them are will seem more interrelated than others not for tonight, but for moving forward. And I'm also keeping a list of questions that have been asked so far that board members would like to hear before that next meeting too. But one question that I do have is if the recommendation from the county is still 17 or less, if that's still going to be the same. Because I think, it seems like it's a circular conversation. If I was in an administrator's seat, do I want kids back? Sure. Do I have to have 17? If I can't have 17, how do I even begin to figure that? So it becomes sort of this circular issue. And so I would like to know from the county if that continues to be their recommendation. The state of Kansas's recommendation, if you're looking at their navigating change gating document, is actually 15. And Douglas County said 17. I don't know the reason for that, but that's what they gave us and that's what we've been living by. So again, I just want to make sure we're thinking about these things. Not that that's wrong. I don't want our decision making to be arbitrary as we think about that. Also, when we talk about risks to students, as we know, schools don't exist in a vacuum, and the staff are in a higher risk cohort than the students are. So balancing that, I'll say as a mom, I would love for my kids to be back at school 5 days a week, one in particular. I can tell for a lot of reasons that would be best. As a board member, I'm struggling with that, particularly if, getting the kind of feedback that we're getting looking at the successful ways that we have been able to mitigate. So I'm going to do more thinking about that for sure. But what would be helpful for me is to know what the county's recommendation is for that classroom size. Because we either have to make a choice as a board that, well, we're ignoring your recommendation or we're embracing it. And if we decide that, then we can make decisions based on that one way or the other. So that would be a question that I would have. Another question / thing I just want to make sure and bring up again, and sorry if I'm beating a dead horse, but our two overlying questions for the next meeting, gating criteria. Within gating criteria, there's kind of some subheadings. What is our board position on the continuation of other mitigation strategies and masking? I know how I feel about that, but I want to make sure board members know how they feel about that before we come to the next meeting. Also with that, what are we doing about compliance with masking? For example, personally, I think we should be playing games until school shuts us down. That's my approach. I've said that very straightforwardly. If we're allowing elective surgeries at hospitals, even with the concerns we have, I think we should allow elective activities for people who choose that. How we may delineate that further is a conversation we need to have. That's another part of what we need to decide next meeting. At the same time, what do we do if we have people attending the activity or the game and they're not wearing masks? In my mind, you just lost your 4 tickets, bud. I mean, that's where I'm at, but I don't know where the board is at. Those are the kinds of questions I think we need to be able to give direction on, even with the larger umbrella issue of gating criteria. Moving on to the operational model decision that we need to make about how we deliver education. Questions within that, that's an umbrella issue, but within that, to Mr. Dorothy's point, how are we doing in-school or on-site instruction versus how are we doing, or are we still offering a CELIS? From there, what we must, I mean, we owe it to all the people working on this to also have this be a part of the conversation. How, if we do something operationally different for second semester, I believe we must give some direction about how we resolve a second quarter academically that carries over into January for the first time ever in this district, with potentially a brand new operational way, if that's what the board decides to do. If we have a new mode of operation come January 4th-ish, we must give direction about how to tie up what happens in the second quarter through January 22nd. Connecting those things together, I just don't, I know we can't get in the weeds on that, but I do think we need to give some direction on that to give people something to tie their hands around. Because they're the experts, right? But we got to give some direction on that. I think it's the only fair thing to do. And then there was one more thing related to that. Oh, lastly, and this will either be wildly popular or you'll all think, well, I should just go ahead and resign now. I think we need to have a philosophical discussion about how much time we should be spending on assessments. I think methods of evaluation are important for our internal purposes, but we need to have a board philosophy on that. Metrics and tools of evaluating in one climate, even as we are, sorry to use you as the example again, Mr. Dorothy, but the KEEP rubric from the Kansas Department of Education, as we know, if you've gone through that, little plug, deadline for that is November 11th, guys. But even that, the questions that it asks in terms of superintendent performance are really, some of the questions are almost irrelevant in terms of how do you evaluate how your superintendent has done in COVID versus how much time did your superintendent spend on discussing the strategic plan. Dude, we were in not strategic plan mode, we were in triage and we were keeping people going. It's a different way of evaluating. I would submit the same is true for many of our state assessments. And I'm not saying that they're not important. I understand very realistically the tie to funding. They're definitely important for our internal purposes, don't get me wrong. But the extent to which we ask staff to spend juice on that, and whatever leeway we have with that, administrators might be looking into that, but again, those would also be helpful things if there was a board philosophy about what our expectations are or are not in this climate. So I think those are all, I know they broadly fit under those two things, but there's more there that I think would be helpful to our entire district team if we're able to really put some thought into that prior to that next meeting. So those are my notes, and I'll be quiet now and let other board members contribute questions or comments, things we want to think about before the next round.
One thing that keeps coming up in the letters that we get and throughout the semester is the goes with the gating criteria, but with sports. And I think that we should have a dedicated time for that. And this kind of goes with the masks and compliance and everything too. But a lot of the comments that we got this week, or today and yesterday really, have to do with questions and ambivalence there. And I think that we should really have a focus on getting something solid there. Especially since we're kind of moving from outdoor to indoor, I think is a big one. So I would just add that.
I've said this before. First, I think that county has provided us with imperfect but really valuable guidance in a very unprecedented period, and I'm grateful for that. I'm not opposed to looking at a gating criteria that is somehow a little more nuanced or a little more local. I don't know exactly what that looks like, and I think we have to be very careful if we start reaching out and saying, well, what about this gating criteria here and this one here? Because to me, those things without the context of everything going on in that community, from testing rates to masking compliance to all those things that feed into it, are not especially relevant.
Who else?
I guess I have one more question for you, Kelly. You were talking about assessments. Are you talking about amount of time we ask our students to prepare in the classroom, or what are you thinking exactly?
Both. I think there's so much remediation that we already began the year with, and I'm not anti-assessment like on principle. I think there are too many. I've always thought that. But in terms of the extent of juice for staff to what they have to do to prepare for assessments, and if we continue to offer remote, how that's, I mean, they're already managing all of that and have done so brilliantly. But I just think that to me, it's not the priority this year. That's just my personal opinion. Again, I know there's a lot of that that's tied to funding, and we need those metrics so that we know where our kids are. What do you need? I'm not debating that, but in terms of the many hoops that we are asked to jump through with the number of assessments, I just think having some guidance on that, or, I mean, that would be a bluff I would be willing to call in this year, in this climate, if it's tied to funding. But I don't know if other board members feel that way, and I would understand with good reason if they don't. I just think the educational needs are so much different this year, and excellence can be defined in a different way, not a lesser way, but an acknowledgement of what student needs actually now are. And those needs have changed. And I'm not an assessment expert. We would have to have Jana talking to us more about that. But for example, HESA, just so that's out for the public record, pause, right?
Correct.
Yeah, we don't need staff working on HESA, come on, you know? I'm not saying it's not important. It's a philosophical thing that we do that makes us better. And these are good things. But in terms of the priority list of 1 through 10, does it even hit the top 10? And should it this year? I don't think it should. And I'm really glad that that decision has been made. But are there other ways that we can make sure our staff and our administrators are empowered to do what we need to do for kids? That's just a philosophical discussion, not in an anti-assessment way in general. I'm talking 2020, what do we need to get done? I think that's part of that, to answer your question.
I think regarding the assessment question, it's a good point to bring up, and I think the more important piece is how are we using the assessments? If we're using those assessments to determine where a student is and what that student needs, I think it's important. If we're using it as a demonstration of learning, I think this is a real opportunity for teachers to be creative with how students are demonstrating the learning. So, I mean, there's so many different categories of assessments. I think we got, drill down to, is this a universal screening? We need to determine where the student is. Is this just a validation of that universal screening? That's not necessary.
Absolutely. Yeah, no, I get your point too.
As far as the remote learning, if Accelis is an option to drop and go to another format, or the people have mentioned other ones, other districts doing the on-site teachers doing the remote learning. I'd like information on that and the options there. This meeting is going to be so long. We should order pizza or something. 2 days.
To just touch on one other thing you brought up, Kelly. I don't know what everybody else is thinking. I might be on an island here. I don't see making a major shift in how we're tackling all these issues until semester break. I don't want to lop off those 2 weeks in January and say we're going to shift everything here and everybody needs to redecide. To me, that sounds too messy.
The only reason that I would think that we would want to look at some of these is because, one, there's so many people that are unhappy with things, but then we could kind of look at options in case unfortunately, in case we're in this situation next year, so that we could try for a short time, and then we have 2 semesters of trying a little bit, and then kids could have a little bit more of consistency next year if we've tried some other options. I don't know if that's the right way to look at it, but that seems to make sense to me. I don't know. At least to talk it through maybe, but you have a good point too.
Any other comments or questions in preparation for November 23rd? Okay, well, I think we have all of our different points of what we still need more information on, and then finishing up the results from the survey, which we'll have as well by the next meeting, and then answers to the questions we've posed tonight. Unless anybody has anything else, I think we've accomplished what we needed to do this evening in terms of just adding more information for us to continue to discern. Before we adjourn, I would want to, I sort of did it in the sly way before, but now I really want to say it. Just a reminder that evaluation is for Mr. Dorothy is due November 11th. And once I receive that, I'll culminate the results for that first part. I will issue a second survey with all of the qualitative responses with the Likert scale. So there will be a part 2 of the survey that then you'll have the opportunity to do. That will go out. So just so we're all on the same page with where we are in that process. And thank you to those of you who've submitted so far. That's awesome. Unless anyone has anyone else, I think we're ready for a motion to adjourn. Carrie has moved that we adjourn. Is there a second?
Second.
Phil has seconded. All those in favor of adjourning, please say aye and raise your right hand. Aye. Meeting adjourned 7-0. Thank you very much. Thank you for coming. Thank you for tech. Thank you, Kay. Thank you, Megan, for sanitizing, and thank you for all of you who came tonight.